Good.
Okay, go ahead.
I'm rolling. So we ready?
Thank you all for being here today. My name is Frank Kim. I'm the County Executive Officer for the County of Orange. Today you will hear from Dr. Nicole Quick, our County Public Health Officer, David Suleilis, our Director of Public Health, Sheriff Don Barnes, and myself. Again, thank you for being here. At this time, I would like to invite Dr. Nicole Quick. Dr. Quick?
Hello, I am Dr. Nicole Quick, County Health Officer. We know that older adults ages 65 and older are at increased risk for developing serious illness from COVID-19. I want to drive home the seriousness of these potential health complications and get the message out to those that work with this vulnerable population to stay home if you are sick. Facilities that take care of and house older adults, such as nursing homes and assisted living communities, should prohibit all visitors unless they are essential. For visitors to those facilities, it is in your loved one's best interest that you don't visit them while sick and that you practice social distancing when you do. I urge you to respect and follow the facility's visitor policies. And to all of us in Orange County, this serves as an important reminder to follow the governor's and state and local health officials' orders to stay home except for those who work in essential services and for when you need to go out for essential activities such as grocery shopping or medical appointments. We all need to be all in to protect those most vulnerable in our communities. We understand that residents may be experiencing fear, anxiety, and isolation related to COVID-19 and want to make sure that you know that the OC Healthcare Agency is here to support your mental health well-being. I'm pleased to share that a new public service announcement called Building Resiliency is available now on our website at www.ochealthinfo.com/novel coronavirus. I encourage you to view and share this resource. Additionally, if you are feeling anxious and would like to speak with someone for support, you can call the Orange County COVID-19 hotline daily at 833-426-6411 to connect with an OC Healthcare Agency's mental health support resources. Now, a comment about personal protective equipment. Personal protective equipment continues to be in short supply. The governor this weekend announced a series of efforts to get more personal protective equipment into the state and into the hands of frontline healthcare workers. The state has made requests to this strategic national stockpile and has been directly procuring personal protective equipment as well. The OC Healthcare Agency has distributed over 1.1 million units of supplies from our local warehouse since mid-February. That includes surgical masks, ventilators, face shields, gloves, goggles, gowns, and hand sanitizer. Last Friday, we received a shipment of over 50,000 masks that are approved for use and immediately began fulfilling requests to local healthcare providers, though we are still far from meeting the total need. Our message to healthcare providers is to continue to submit requests. We will continue to place orders with the state and procure directly from vendors whenever we are able to and fulfill orders on prioritization as soon as supplies arrived in Orange County.
Hello, I'm David Suleilis, Director of Public Health Services with the OC Healthcare Agency. The OC Healthcare Agency is monitoring the status of our hospitals and healthcare system daily. All hospitals with emergency departments are operational and have canceled all non-essential services and are actively preparing for patient surge. The system remains at low or below typical levels of activity based on our bed census. As the number of COVID-19 cases in California, and in Southern California in particular, continues to rise, our efforts are increasingly focused on planning for surge in our hospitals by identifying and standing up alternate care sites that can be used to decompress hospitals when they are full and allow them to focus on COVID-19 patients. The governor has indicated that California is preparing for an additional 50,000 beds to meet the potential demand at the height of the outbreak. This planning is between federal, state, and local partners and is regional in scope, meaning that beds created in the Southern California region can be used by all jurisdictions regardless of where the beds are located within the region and based on surge at each hospital. We are actively working with the state to site a large regional alternate care site here in Orange County. As mentioned, planning for alternate care sites is a regional process. So far in Southern California, the governor has announced that St. Vincent's in Los Angeles and Long Beach Community Hospital in Long Beach will be part of the alternate care site asset in Southern California. The federal government is standing up at least 3 federal medical aid stations in Los Angeles County as well as part of the overall surge capacity in the region. And starting this past weekend, OC hospitals were notified by the Los Angeles and Orange County Emergency Medical Services agencies that the USNS Mercy ship is open to receive patients in order to support anticipated COVID-19 surge. More information will be forthcoming on all of those efforts around surge planning and capacity. On Friday, the OC Healthcare Agency updated its website to make it more user-friendly and intuitive, and we added additional data, graphs, and charts to help the public better understand the nature of COVID-19 in Orange County. Case counts on our website are updated each day by 2 p.m. It is important to note that data posted each day are preliminary and subject to change. More information may become available as individual case investigations are completed. One of the graphs we added was daily case count so that the public can see how cases are trending over time. If you check the site daily, you may notice that case counts fluctuate from day to day, sometimes higher, sometimes lower. The case count on any particular day is not as important as the overall trend of cases up or down, and this graph helps all of us to monitor that trend over time. We also added daily city case counts on Friday, and when doing so, inadvertently left off the city of Laguna Hills. It has now been added to the list. Regarding cities with populations of 25,000 or less, we have determined that we can protect patient confidentiality and begin posting case counts for those cities once a city has 5 or more cases. So, when a city with a population of 25,000 or less reaches this threshold, it will be added to the list of daily city case counts. This compromise addresses concerns raised by our smaller cities and allows us to protect patient confidentiality. Now I'd like to invite up Sheriff Barnes.
Thank you, Sheriff Don Barnes with County of Orange. Just want to give a quick update on 2 areas in which we are progressing. The first is pertaining to the release of inmates early from our custody. We've been working through this issue for the last 2 weeks with key stakeholder groups, including the courts, the public defender, and the district attorney's office to come to some resolution on how we would progress as an organization in the event it became necessary to release those entrusted to our care early. Over the course of 2 weeks, we were working towards resolution, and up until about 5 days ago had adequately addressed the concerns within the jail before we had an outbreak. Last Wednesday, we announced our first case of COVID-19 within our jails and took immediate action to both isolate and quarantine those who might have been exposed. The next day, we had 2 additional cases and have since quarantined those individuals as well. To date, we have 9 individuals being isolated within the jail who are showing symptomology consistent with COVID-19. Of those 9, we've had 5 positive tests, adding 1 more today. And we currently have almost 150 inmates in our care being quarantined and under observation. Quarantine are those individuals who may have been exposed to COVID-19 but are not showing symptomology. As a safeguard, we quarantine those to try to stop the spread throughout the jails. As a result of the early release protocols we put in place, this weekend we released 130 individuals from our care, in addition to the regular individuals that would be coming up on a scheduled release or sentence expiration date. To date, since March 1st, our jail population has decreased over 800 people. That's through natural attrition, in addition to the 130 from this past weekend. It's a 15% reduction in our jail population. We are vetting several rumors, if you will, or questions being asked about crime trends as a result of COVID-19, predominantly cases that might be handled as an increase because of people staying at home. I can tell you that we have not, and we've looked at year-to-year dates from last year to this year, and specific to these periods, there's not been an increase of domestic violence cases. There's not been a statistical increase of disturbance calls. What we have seen, though, is a decrease in property crimes and traffic collisions, most likely because of the reduced traffic that's going on through Orange County. With that, we're working through this as we go forward. The first wave, and I will mention that those who we released early were on two groups. Those who were released or targeted 10 days early or less, that met the criteria for release as designated to the courts, and also a population that is most at risk. That's defined by the public health officer order as being 65 or older, or having pre-existing health conditions. And for that population, we went 60 days back. And through those two groups, we released 130. 43 of those were the medically at-risk population we defined. That population still had to meet the same release criteria based on crimes as anybody else that we would release. With that, I'll turn it over to our CEO, Frank Kim.
So at this time, we'll take questions from the media. I believe we have media that are on the call. Hello, we're available to take questions from the media at this time.
You mean you're anything insane? Hi, this is Gerda, Voice of the Sea. Can you guys hear me okay?
Yes, we can hear you.
Perfect. Other counties, including San Diego County, have been posting hospitalization data online with full numbers for people hospitalized with COVID and the number of people in ICUs. I think the governor is also releasing data along these lines. Is Orange County planning to release information about hospitalization levels, capacity, and the remaining need for personal protective equipment and hospital beds?
We are working presently to get hospitalization data posted on our website. I'm hoping that'll be up within the next day or two, and continuing to evaluate the data that makes the most sense to put out for the public and for all of us from a planning perspective, and to understand what's going on moving forward.
Can you tell me what the need is currently in terms of personal protective equipment and hospital beds?
So in terms of hospital beds, as I mentioned, our hospitals are currently operating at below capacity. So we have excess capacity in the system right now because all of our hospitals have taken the prudent and important steps of reducing elective procedures to really make the maximum number of beds available in Orange County at the present time, and to retain
now joining,
and to be able to retain those beds for COVID-19 surge capacity. As I also mentioned, working with the governor and his team at the state and our regional partners, we are working to bring on alternate care sites throughout the region in Southern California to help maintain that need. So at the present time, we are adequately supplied with beds. As we look forward to the next couple of weeks, we will be ramping up significantly to make sure that surge capacity is available in our communities. In terms of personal protective
equipment,
equipment,
of what that surge capacity need is, like projecting out to mid-late April peak projection.
Sure, we are working on those projections at this time. That's part of our ongoing planning process through our Emergency Operations Center to help us inform that planning moving forward. We hopefully can speak to that a little bit more detail as the days unfold. And in terms of personal protective equipment, I think it is just fair to say there is a nationwide shortage of personal protective equipment everywhere in this country. We in California are doing our best with the leadership from the state and with all of our partners to try and secure as much PPE as possible to meet the needs here in Orange County.
Oh, hi, Dave. This is Skip Yost at KTLA. I don't know if anyone else on the call has any experience. Did you guys give some opening remarks? The first thing I got 6 minutes was, are there any questions? Did you guys have some opening remarks during the first 6 minutes?
Yes.
We didn't hear anything yet.
Yes, we did. It was broadcast through Facebook Live as well, and there is camera in the room as well. So if you have any questions, we'd be happy to address those at this time.
Okay, I don't know if you've addressed this already then. My question was just on the, if we can't make a trend out of a couple of days, but I just wanted to get some perspective on the last couple of numbers of new cases. I think it was 30 something today, 28 yesterday, compared to Thursday, Friday, and Saturday of last week, where it seemed to go up a lot higher each day. Do you guys yet know how many negatives you're getting every day as well as positives, or do you still only get reported the positives?
So if you look on ochealthinfo.com/novel coronavirus, daily we post the total number of people tested by our Orange County Public Health Laboratory as well as commercial laboratories to date. So for today, you will see that 5,522 tests have been completed to date in Orange County by our local public health laboratory as well as commercial laboratories. We do get reports of both positive and negative results. So we are seeing the total volume of testing occurring each day. In terms of the case counts per day, it's important to remember that a single day's case count does not indicate a trend. And the reason we are providing the graph with daily case counts is to allow all of us to look at case trends over time. So we really want to watch what's happening in the coming week or two to see how this trend unfolds.
Hi,
Oh, that's okay.
go ahead.
Margaret Guerrero with KNX Radio. Just hoping to have a question for Sheriff John Barnes.
Sure, just to qualify, everybody who's online or listening did not hear any of the opening remarks?
No, I
did not.
Okay, would it be
Yes,
okay? And I'm
yes.
just going to ask for the group if I could just summarize my statement in a minute or less, and maybe that might answer some of your questions, if that's okay. I covered two areas of interest, I believe, for the public and the media. The first had to do with our early release strategy going into just last week. For 2 weeks, we were hoping to get a court order allowing for the early release. That did not occur. We got through working through the courts in a collaborative process, including the DA, public defender, and Superior Court, was able to deter the need through last Wednesday. We had the first positive case Wednesday night. We had 2 additional cases Thursday night, and then moved towards the government code that would allow me to release based on imminent or exigent threat during the emergency. To date, we released over the weekend 130 individuals. Of those 130 individuals who were released early, 43 of them were designated as medically at risk. Those are the individuals provided to us by healthcare agency. They provide the in-custody medical treatment within the jail, and identifying everybody who they believe were at risk, and then we pared that down to those who were eligible for release. So we had, do the math, the balance of 130 were released 10 days early. They had to meet the same qualifying criteria as were designated through the courts, no violent offenses, those type things. And the 43 medically released inmates or medically at risk were identified, they were released up to 60 days early because of their medical conditions. The medical conditions are defined by the public health officer as 65 or older or pre-existing medical conditions. To date, since March 1st, our jail population has decreased exactly 838 inmates during that period, 15% reduction. And we currently have 9 individuals still on medical isolation being symptomatic with conditions that are consistent with flu-like symptoms. Doesn't necessarily mean COVID. We do test them. We have about 149 to be specific, who are medical quarantine. And also of those, we have tested 5 positive for COVID-19.
So, Sheriff, I had a quick question with regard to the 5 that tested positive. Is that in addition to the 3 last week, or is that 5 total now that have tested positive?
It's an accumulative total. So we had 3 last week, we've added 2 more. and we have five that tested total positive within the jail. I did
And
want
those
to
are all inmates?
Yes, all inmates, no staff. We have had staff who have had symptomology throughout the department, not specifically to the jail, and they have been tested, and anybody who would have test results back have tested negative to date. We still are pending some tests going
And
forward.
Sheriff, you said you released 130 inmates to date. How many might be forthcoming?
I don't understand. We've released 130 inmates pursuant to the authority granted to me in the government code for early release. Every other inmate that's been released prior to that was a sentence expiration date. Their time had come up and served in jail and were being released pursuant to just normal protocols. It is also important to note that in the interim, the number of people being brought to the jail has reduced because courts have been closed, remands to my custody have been reduced, and so we're net positive or reducing our jail population through natural attrition. That equates with the difference of the 838.
And what is the status on protective gear for jail workers? I know we've talked a lot about hospitals and whatnot. What's the status on protective gear for those who are in the jail?
So our PPE for first responders, we have two different logistical networks that are working for healthcare agency, which is covering the medical professional side, and then the law enforcement first responder side, which covers law and fire. That's being done through our emergency operations center with requests going out. We have donation capabilities. Currently we have PPE for all of our jails and our first responders. There is a burn rate, or the rate in which those PPE equipment is being utilized. So like everybody else, we are still trying to, I don't want to say compete, but we're all asking for the same items. And this is not just county or region or state. Nationally and even internationally, we have a demand for all of these items at the same time, which is causing significant challenges for us to have those. To date, we do have enough, but that's not, we don't have enough to go long term. We have to add to that stockpile locally to be able to address these things beyond the next week, 2 or 3, whatever that item is that we're hoping to work with.
Sheriff, I want to tell you this. I want to ask, you have 100, I want to make sure I get the numbers right. So 130 were released per that court approval, and another 43 were medically released?
No, Tony, that was 130 total. Of the 130, there were 43 included in that number that would be part of the medically at risk. And that's not, that 130 is separate than just the weekend releases that would have come up normally. So over the weekend, we actually we had over 300 releases. Some would be normal sentence expiration dates, and those that were part of the early release identification for 10 days or less if they qualified based on their charges. And then we went 60 days back for those who are designated medically at risk. And we're doing the evaluation now to find out if the 10-day early is going to net us enough space to be able to deal with the issues that we're forecasting. And if it doesn't, we'll go beyond that. We may go to the next 10 days, or we may go 30 days out for those individuals as well.
So that's a total of 130?
It's a total of 130. Just for clarification, Tony, between March 1st and now, our jail population has decreased 838 beds. So it's the lowest it's been in well over a decade. It's still, but this is the challenge that we face. We have single cell housing, we had modular housing, and those would be 1 or 2 man cells. We have dormitories and barrack style housing. Our barrack style housing can go up to 192 inmates in an open barrack style. And as we try to mitigate the social distancing, if you will, within a jail, it becomes very difficult to narrow the population of barracks and dormitory style housings. We've been able to do that significantly. We don't know if we've been able to do it effectively enough. And if, as we do our evaluation, as necessary, we will release additional inmates as they qualify. And then when we quarantine them, we have to quarantine them in smaller spaces, usually the single man cells. So those are usually reserved for higher risk inmates inside the jail. It's a long mathematical equation, if you can imagine, trying to navigate keeping everybody appropriately separated within the jail who are at risk for different reasons, quarantining individuals within the jail system for medical reasons for
These
exposure.
five inmates who tested positive, are they all isolated from each other as well, or are some of them in two-man cells, or what?
They are isolated. Some, if they are positive, my understanding through healthcare, and I'm looking for a nod that they can be housed together if they are positive, they test positive. Those who are medically isolated waiting for test results, we try not to do that because we want to cross-contaminate somebody who might be positive, somebody who might not be positive for COVID. So it's all these layering of protocols that we are navigating through to make sure that we are appropriately keeping people away from each other while still maintaining a functioning jail, which is by default difficult in and of itself. I did want to state though, while I have you here, we're going to put a press release out later. We did have an in-custody death that occurred last night at the hospital, somebody who was from our jail, transferred there. That person was in medical isolation observation before, not for COVID-related incidents, and a pre-existing health condition. As a safeguard after that individual did pass, and that's unfortunate, and our heart goes out to that person's family and loved ones. We did, as a precautionary measure, test for COVID-19 through the coroner's office to either affirm or validate whether he was or did not have it. My understanding is the symptomology was not absolutely consistent with somebody who had COVID-19, but as a safeguard we tested.
John Park, County Register. Can you guys hear me? I just want to check if there's what's the situation like in the county's nursing home, homeless shelter. Has there been any cases that's been found there? What's curious about that?
Unknown participant is now joining us.
I'm sorry, just to qualify, your question was regarding homeless shelters and if there's been any cases of COVID? Is that?
Yeah, and nursing homes. Just kind of wondering whether this is more for probably David or some other folks, but I was curious about what the situation has been like in those facilities so far.
Yeah, so we are continuing to monitor and work with both our congregate living settings, nursing homes, assisted living facilities to get guidance out. As far as same with homeless shelters as well, we have not been confirming a case in a homeless shelter or in those congregate living settings as of now, but we continue to work closely with all of those facilities.
Dr. Quick?
Yes,
it's Michelle Geely. Can I ask you please about the most recent case numbers? Today I believe it's 37 and yesterday it was in the 20s. What is that telling us, if anything? If we look back 7 days ago, it's approximately that same number in the 30s. I mean, are our stay-at-home requests working? What is your opinion about this?
Sure. So important to note, and we apologize that some of you might not have heard statements we all made. The importance of a trend in following cases over a period of weeks versus a day is that a single day or even 2 days doesn't necessarily mean a whole lot. So we want people to continue to follow what our cases are over a period of time. No real specific comments about why we have had less in the last 2 days. Once again, it's going to be the trend that is important to follow with that. And the other part of your question was, did I answer all of it, or can you repeat?
Yeah, the stay-at-home request, do we have any evidence that this is helping to flatten the curve?
Yeah, once again, we have to continue to follow our data for a longer period of time. We're only, a short amount of time into the stay-at-home orders. Those are not recommended to end at the end of this month. And once again, it's too early to necessarily tell, and I would not attribute some of the stay-at-home to the last 2 days. We need to continue to follow our trends going forward to be able to make that determination. Want to take the opportunity to remind everybody that it's very important for everybody to follow both the governor's, state and local health officer orders to remain at home unless you are leaving for essential business or essential activities such as grocery shopping, medical appointments, and so forth. It's very important for all of us to continue to do so.
How about a surge for us at Orange County? We had heard something about a surge maybe coming over this next weekend.
Yeah, we have not released any timing as far as a surge coming in the next week. And what I think is important for everybody to know that we are actively planning and increasing our surge capacity statewide, regionally, as well as in Orange County.
Dr. Quick, and following up on that,
Go ahead.
the regional care, I was a little confused when David mentioned, might there be crossover? If I'm ill in Orange County, would you take me to the LA Convention Center? Is that kind of cooperative thing going to have to happen?
Sure, so let me explain how this works. In a normal event where we had potentially saw a surge on our facilities in Orange County, we will do our best to meet the medical needs of Orange County and local resources. If we exceed our local capacity, then we look to our region, which may include assets in other counties. And absolutely, when we have an event like this that's expected to cross sort of county lines and be a region that's experiencing a surge, we will use all resources throughout the entire region to meet healthcare needs of all individuals in our region.
Thank you.
Dr. Quick, in the advisory that the county sent out on Friday, I think I saw something about how the private labs are not required to report the positive cases to the county. Did I see that right? Or was that something that I missed?
Yeah, well, let me just explain. Yes, but due to California law,
Participant is now joining.
both commercial labs across the board and hospitals are required to report positive COVID-19 cases to us.
How was the congregating in the parks and beaches this weekend?
So I did receive a report from our park staff over the weekend, and they report that at the beaches and parks that all the residents were in general following the guidance for safe distancing. So we have not experienced those issues over the weekend. So we have about 1 minute. Let's take one more call. Well, thank you very much. We really appreciate you participating today, and we look forward to continuing to share information. We do have a special board meeting tomorrow at 9:30. We encourage you to participate and watch that. Thank
Is
you.
now exiting.